the healthcare system is more about profit. That's how it is. That's how it's perceived here. And that's why the UK is probably a little bit different, but the trust factor is just, I don't know, authoritative, maybe. Is that the right word?
Yeah, and I think these complex issues, they go back a long time, and I think they are built into people's thought processes over a long time. So if you look, I did some work around why people were resisting, for example, the COVID-19 vaccines, and why were we getting more resistance in our communities, again, people who look like me, the ethnically diverse people. And you realize that even when I brought the conversation home to speaking to people like my mom, her resistance was based on her past experiences with the health system and her past experiences with things like vaccines. And so she would have gone through a patch in her life where things like vaccines have been used against a group of people.
Yes.
And now there is a real need why they must have it, but because they don't have that trust, it just comes and boils on to, no, they resist, right? But it's about understanding, how do we go beyond the resistance? And we need to understand why they are resisting. So part of the project that we did was just really doing surveys into understanding, why was there resistance? And so the key factors that we came up with, like I've said to you, was mistrust of the system. And number two, religious and cultural beliefs. My mom was simply saying, she's a good example, because she would say, no, because God is going to heal me anyway. I don't have to worry about, these things. So now it means in our platforms, when we are now creating our platforms, we are taking time and making our AI look at people's religious beliefs as well as their cultural beliefs as part of the assessment process. Because if you are going to look after someone and you don't understand their cultural beliefs and their religious beliefs and what barriers exist, you are going to miss on the diagnosis, or you're going to miss on the reasons why they are thinking the way they are. So you are going to help them. So, sorry, you would improve your help, how it's going to benefit that person if you understood these pre-existing issues or factors.
You would know how to communicate with them, right? Because your language, how you're talking to somebody, will affect what they're going to think and what to believe, and you could communicate properly. And to be honest,